And it is time for our nightly Q&A. We call Ask the Doctor, and Dr. Jonathan Dario is a family physician affiliated with Adventist Health Bakersfield. Good evening, doctor. Hope you had a restful holiday weekend.
Thanks, Tammy.
Really.
And speaking of the weekend and the scenes we saw over the holiday here, big parties, swarms of people, packed beaches, thousands of people clearly ignoring any semblance of social distancing. People are tired of being cooped up, it's clear. But do scenes like what we saw give you pause when you think of the personal responsibility we all have going forward in trying to prevent the virus from spreading?
Well, I just hope that with those big gatherings, at least people were trying to be safe. They kept their hygiene up and washed their hands and did the best they could. But, going forward, of course, I know everyone is tired of the whole being cooped up at home, but, it's still just best for us to try as best as possible to limit how many people we expose ourselves to, wear masks when we can, keep washing our hands, keep them clean, so that we limit the exposure. I guess it does give pause in that you worry that these people, especially if someone was carrying the coronavirus, then we're going to have a big surge, especially from that group. Yeah. But hopefully, since testing is available, we'll be able to catch it, be able to find out those people who got exposed and became sick from it.
Good evening to you, Doctor. As we reopen the economy and there are less restrictions on social gatherings, a lot of kids are asking their parents, hey, when can I go hang out with my friends? What is your advice for parents on that one? I think it's about educating your kids. Obviously, if they know that some other children, of course, children get sick pretty frequently. If they know that they've had symptoms or things like that, try to stay away from them. Limit, probably just to close friends, but of course, you want to limit that circle as much as possible. As we go forward and we relieve these restrictions, I think we should all take it personal on ourselves that maybe we slowly limit how much we expose our loved ones, our children to others. Of course, it's great that now we're actually able to have some exposure, but we still can make them be safe. It's train your kids to wash their hands again, be safe, to avoid people who are sick, and if they can limit that 6 feet. There are a lot of fun games that you can play where you're 6 feet apart, no actual physical contact. So.
Yeah. And I want to ask you, Doctor, the World Health Organization has stopped trials of the anti-malaria drug hydroxychloroquine, citing safety concerns, and President Trump, who was taking it, has also since stopped. However, early on there were reports that it was helping patients with COVID-19 when used with azithromycin. Two questions for you. Are there local patients, do you know, that have been treated with hydroxychloroquine, and what does this mean for treatment of patients going forward?
When it first came out, it was, hydroxychloroquine is just a drug that's very available. And there were some signs that it was hopeful. But of course, like I think we've talked about previously, where, there's no proof yet that it's actually showing any benefit. And there are a lot of side effects that needs to be done with people who are very sick. So, typically we would reserve it to people who are actually sick. Because it's a chance of using a medication on someone that might give some benefit. So far, we've seen most of the time it doesn't have that benefit. But of course, for those limited few that it did, it may have provided some extra hope or extra care for that patient. Yeah. Going forward, we do have other options. As the plasma transfusion and all the other antiviral medications are trialed. There's some showing some benefits anecdotally. Of course, it's still one of those things where we think we're seeing something that might be beneficial, but of course there might be a lot of side effects to these medications in the long run. So there's still a lot of tools they're trying out to see, to help for combating those who are severely sick. But again, those who aren't on the other spectrum, not as sick, actually pretty asymptomatic. They're pretty safe on not getting any treatment right now. So It's just watching, taking care of yourself, just like you would if you had a common cold or flu.
All right, Dr. Jonathan Dario, as always, we really appreciate your time. Thank you so much for joining us
Thank
tonight.
you, Doctor.